But first, the reality is, and I'm going to talk facts with you here today, that COVID-19 will be endemic. It's always going to be around. There will be many new strains, and there will be some deaths, as there are every year, from the flu when we eventually reopen the country. These are hard truths that politicians and public health bureaucrats in this country refuse to address. COVID will always be around. How quickly we seem to forget that 1,255 Australians died of influenza in 2017, according to the ABS. In that year, influenza and pneumonia accounted for over 4,000 deaths in this country. The only way ahead is to treat COVID-19 like a virulent strain of influenza, not the Black Death. It's what many renowned experts have called for from the start of this pandemic, but they were ignored or maligned, and the world, with a few notable exceptions, followed China's example, who claimed to have eradicated the virus by locking down Wuhan. If you believe that, then you'll believe anything. As the rest of the world reopens and learns to live with this virus, and let's be clear, they are reopening not with 80% vaccinated, like we are aiming for, but much lower rates than that. But as the rest of the world reopens, our country is strengthening its Fortress Australia strategy. We are cancelling events in November, such as the Grand Prix, and have halved the number of overseas arrivals. It was only last Friday on this program where we're discussing the Prime Minister spruiking a four-phase plan to reopen the country. But it wasn't really a plan, merely a plan for a plan. The only concrete detail was halving the number of overseas arrivals. Now, a week later, we have gold standard Gladys pursuing an eradication strategy, and we are more isolated from the rest of the world than ever. And that comes with enormous cost, and not just economic costs. There are real health and societal consequences, from the spike in youth self-harm to missed cancer screenings. All this to focus solely on a respiratory virus that disproportionately impacts the very old and infirm, with the median age of COVID deaths in this country sitting at 85 years of age. As the rest of the developed world returns to normal, Australia and our equally scared witless cousins in New Zealand continue to hide under the doona.